The respiratory system. The respiratory system consists of the organs that help to breathe. Respiration, also known as breathing, is the process which delivers oxygen from the external atmosphere to the body and removes the carbon dioxide from body and expels out. The main parts of the respiratory system are the nose, pharynx, larynx, trachea, lungs, bronchi, bronchioles, alveolus or terminal air sacs, and the diaphragm. The nose is the only visible part of the respiratory system. During breathing, air enters the nose by passing through the nostrils or external nares. The interior of the nose consists of the nasal cavity divided by a midline nasal septum. The nasal cavity is separated from the cavity below by a partition, the palate. Anteriorly, where the palate is supported by bone, is the hard palate. The unsupported posterior part is the soft palate. The cleft palate happens when there is failure of the bones forming the palate to fuse medially, results in breathing difficulty, as well as problems with oral cavity function such as chewing and speaking. Rhinitis is the inflammation of the nasal mucosa. Sinusitis is the inflammation of the sinus. It is difficult to treat and can cause marked changes in voice quality. The pharynx is a muscular passageway about 13 centimeters or 5 inches long that vaguely resembles a short length of red garden hose, commonly called the throat, common passageway for food and air. It is continuous with the nasal cavity anteriorly via the internal nares. Air enters the superior portion, the nasopharynx descends through the oropharynx and laryngopharynx to enter the larynx below. Food enters the mouth and then travels alone with air through the oropharynx and laryngopharynx. Instead of entering the larynx, food is directed into the esophagus posteriorly. Clusters of lymphatic tissue called tonsils are also found in the pharynx. So this is now the frontal sinus, nasal cavity, the epiglottis, the sphenoidal sinus, the nasopharynx, oropharynx, laryngeal pharynx, larynx and vocal cords, esophagus, trachea, then the right lung, the left lung, the right bronchus and the left bronchus, the mediastinum, the horizontal cross-section of lungs, the diaphragm, the terminal bronchiole. The larynx is the voice box, routes air and food into the proper channels and plays a role in speech. It is formed by 8 rigid hyaline cartilages and spoon-shaped flap of elastic cartilage, the epiglottis. The largest of the hyaline cartilages is a shield-shaped thyroid cartilage, which protrudes anteriorly and is commonly called the Adam's apple. Epiglottis is the guardian of the airways. It protects the superior opening of the larynx, and part of the mucous membrane of the larynx forms a pair of folds called the vocal folds or true vocal cords, which vibrate with expelled air. This ability of the vocal folds to vibrate allows us to speak. The slit-like passage between the vocal folds is the glottis. This glottis produces sound waves. The trachea, air entering the trachea or windpipe from the larynx travels down its length 10 to 12 centimeters or about 4 inches to the level of the fifth thoracic vertebra. Heimlich maneuver is a procedure in which the air in a person's own lungs is used to pop out or expel an obstructing piece of food to save many other people from becoming of such coronaries. Tracheostomy is a surgical opening of the trachea. So these are the sinuses, the pharynx, larynx, the trachea, the bronchial tube, the lungs, and then of course the alveoli. The main bronchi, the right and left main bronchi, are formed by the division of the trachea. The right main bronchus is wider, shorter, and straighter than the left. It is the more common site for an inhaled foreign object to become lodged. By the time air reaches the bronchi, it is warm, cleansed of most impurities, and well humidified. The lungs are large organs They occupy the entire thoracic cavity. Its apex, the superior portion, is located just deep to the clavicle. The broad lung area resting on the diaphragm is the base. Each lung is divided into lobes by fissures. The left lung has 2 lobes and the right lung has 3. The surface of each lung is covered with a visceral serosa called the pulmonary or visceral pleura. The walls of the thoracic cavity are lined by the parietal pleura. The pleural membranes produce pleural fluid. Pleural fluid is a slippery serous secretion which allows the lungs to glide easily over the thorax wall during breathing moments and causes the 2 pleural layers to cling together. Pleurisy is the inflammation of the pleura caused by decreased secretion of pleural fluid. The pleural surfaces become dry and rough, which results in friction and stabbing pain with each breath. After the primary bronchi enter the lungs, they subdivide into smaller and smaller branches, finally ending in the smallest of the conducting passageways, the bronchioles. Because of this rebranching of the respiratory passageways within the lungs, the network form is often referred to as the bronchial or respiratory tree. The terminal bronchioles lead into the respiratory zone. Structures eventually terminate to alveoli or air sacs. The lungs weigh only 2.5 pounds, soft and spongy. The alveoli, the final line of defense for the respiratory. Main parts of the respiratory system and their function, the nostrils, are involved in air intake. Examples, they bring air into the nose where air is warm and humidified. The tiny hairs called cilia filters out dust and other particles present in the air and protects the nasal passage and other regions of the respiratory tract. Trachea, the trachea is also known as windpipe. The trachea filters the air we inhale and branches into the bronchi. The bronchi are the 2 air tubes that branch off from the trachea and carry atmospheric air directly into the lungs. Lungs, the main organ of the respiratory system. Lungs are the site in body where oxygen is taken into and carbon dioxide is expelled out. The red blood cells present in the blood picks up the oxygen in the lungs and carry and distribute the oxygen to all body cells that need it. The red blood cells donate the oxygen to the cells and picks up the carbon dioxide produced by the cells. The alveolus is a tiny sac-like structure present in the lungs which the gaseous exchange takes place. Diaphragm. Breathing begins with a dome-shaped muscle located at the bottom of the lungs which is known as diaphragm. When we breathe in, the diaphragm contracts and flattens out and pulls downward. Due to this movement, the space in the lungs increases and pulls air into the lungs. When we breathe out, the diaphragm expands and reduces the amount of space for the lungs and forces air out. Let's go now to the respiratory physiology. The major function is to supply the body with oxygen and to dispose carbon dioxide. 4 distinct events collectively called respiration must occur. First is pulmonary ventilation. Air must move Respiratory gas transport, oxygen and carbon dioxide must be transported to and from the lungs and tissue cells of the body via the bloodstream. Pulmonary ventilation, air must move into and out of the lungs so that the gases in the air section of the lungs must be made are continuously changed and refreshed. Gas exchanges. This process of pulmonary ventilation is commonly inside the body. Breathing, also called pulmonary ventilation, is a completely mechanical process that depends on volume changes occurring in the thoracic cavity. Rule and mechanics of breathing. Volume changes lead to pressure changes, which lead to the flow of gases. To equalize the pressure, inspiration, air is flowing into the lungs. Expiration, air is leaving the lungs. Mechanisms of breathing. Gas travels from high pressure to low pressure areas. Pressure outside the body is atmospheric pressure. Pressure inside the lungs is intrapulmonary pressure. Pressure in the intrapleural space is intrapleural pressure. Movement of air into and out of the lungs is called pulmonary ventilation or breathing. Air continues to move into the lungs until the intrapulmonary pressure equals atmospheric pressure is called inspiration. When inspiratory muscles contract, intrapulmonary volume increases, its pressure decreases, and air rushes in inspiration. When inspiratory muscles relax, the lungs recoil and air rushes out, that is expiration. Expansion of the lungs is helped by cohesion between pleura and by the presence of the surfactant. Atelectasis or lung collapse, the lung is used as for ventilation. This phenomenon is seen when air enters the pleural space through a chest wound, rupture of the visceral pleura which allows air to enter the pleural space from the respiratory tract. Pneumothorax is the presence of air in the interpleural space which disrupts the fluid bond between the pleura. Non-respiratory air movements are voluntary or reflex activities that move air into or out of the lungs. These include coughing, sneezing, laughing, crying, hiccuping, and yawning. Respiratory volumes and capacity. Factors affecting respiratory capacity are person size, age, size, and physical condition. Normal quiet breathing moves approximately 500 ml of air into and out of the lungs with each breath. This respiratory volume is referred to as the tidal volume. Inspiratory reserve volume (IRV), the amount of air that can be taken in forcibly over the tidal volume between 2,100 and 3,200 ml. Expiratory reserve volume is the amount of air that can be forcibly exhaled after a tidal expiration, that is 1,200 ml. Residual volume is 1,200 ml of air still remains in the lungs. It is important because it allows gas exchange to go on continuously even between breaths and helps to keep the alveoli open or inflated. Vital capacity. The total amount of exchangeable air is typically around 4,800 ml in healthy young males, and it cannot be voluntarily expelled. It is the sum of the tidal volume, inspiratory reserve volume, and expiratory reserve volume. Dead space volume is the air that enters the respiratory tract, remains in the conducting zone passageways, and never reaches the alveoli, that is 150 ml. Functional volume is the air that actually reaches the respiratory zone and contributes to gas exchange. It is about 350 ml. Spirometer measures the respiratory capacities. Respiratory sounds or bronchial sounds are produced by air rushing through the large respiratory passageways like the trachea and bronchi, and the vesicular breathing sounds occur as air fills the alveoli, soft and resemble a muffled breeze. Abnormal sounds are crackle, a bubbling sound, and a whizzing or whistling. External respiration is the actual exchange of gases between the alveoli and the blood. Internal respiration is the gas exchange process that occurs between the systemic capillaries and tissue cells. External respiration, gas transport, and internal respiration. Gases move according to the laws of diffusion. Oxygen moves from alveolar air into pulmonary blood. Most oxygen is transported bound to hemoglobin inside RBCs. Carbon dioxide moves from pulmonary blood into alveolar air. Most carbon dioxide is transported as bicarbonate ion in plasma. At body tissues, oxygen moves from blood to the tissues, whereas carbon dioxide moves from tissues to blood. The factors influencing respiratory rate and depth: physical factors like talking, coughing, and exercising; volition, that is conscious control; emotional factors; and chemical factors, the levels of carbon dioxide and oxygen in the blood. Hyperventilation, when we blow off more carbon dioxide. Deep and rapid breathing. Hyperventilation, extremely slow or shallow breathing. Apnea is cessation of breathing, and cyanosis is bluish discoloration of the skin. Asthma is a common disease, can be due to external causes such as allergens that are inhaled or can be intrinsic. Airway obstruction with wheezing is the hallmark of this disease and can be controlled by medication or may subside spontaneously. A stepwise form of therapy with inhaled corticosteroid drugs and inhaled bronchodilators as effective treatment in most patients. What causes asthma? Asthma is caused by inflammation in the airways. It is not known why the inflammation occurs. The inflammation irritates the muscles around the airways and causes them to squeeze. This causes narrowing of the airways. It is then more difficult for air to get in and out of the lungs. This leads to wheezing and breathlessness. The inflammation also causes the lining of the airways to make extra mucus, which causes cough and further obstruction to airflow. Pneumonia, in addition to intrinsic respiratory system diseases, the lung can often be infected by material that is inhaled. Hence, the disease category pneumonias, which can result from the inhalation of bacteria or viruses. Pneumonia is usually characterized by fever, cough, cutting chests, pleuritic pain, involvement of a segment or lobe of a lung on chest X-ray, and a positive smear or culture of the sputum. These are treated with antibiotics to which these organisms are sensitive. Today, most pneumonias are easily treated and resolved quickly with treatment. Chronic obstructive pulmonary disease (COPD) is an obstructive airway disease that is often due to cigarette smoking and is characterized by cough and sputum production, which is often purulent in character, as well as shortness of breath or dyspnea. It is composed of two respiratory system diseases, chronic bronchitis and emphysema, and the term COPD is used because emphysema has no clinical definition. It can also be treated with inhaled medications called anticholinergics, but it does not tend to resolve with therapy. Treatment tends to suppress the disease, but it continues to progress throughout the patient's life. Its progression is slowed by cessation of cigarette smoking. Bronchitis is an inflammation of the bronchial tubes, the airways that carry air to your lungs. It causes a cough that often brings up mucus, as well as shortness of breath, wheezing, and chest tightness. There are two main types of bronchitis, acute and chronic. Chronic bronchitis is one type of COPD, chronic obstructive pulmonary disease. The inflamed bronchi produce a lot of mucus. This leads to cough and difficulty getting air in and out of the lungs. Cigarette smoking is the most common cause. Breathing in other fumes and dust over a long period of time may also cause chronic bronchitis. Treatment will help your symptoms, but chronic bronchitis is a long-term condition that keeps coming back or never goes away completely. Pulmonary emboli are caused by obstruction of the pulmonary arteries or their branches by circulating materials, usually clots, which come from the heart or from diseased vessels in the thigh. This disease can be characterized by a multitude of non-specific signs and symptoms, including coughing up blood, shortness of breath, chest pain, and swelling and pain in the lower extremities. Because of the non-specificity of the symptoms, they require physician's suspicion in order to be diagnosed in a rapid manner. This diagnosis is often missed with dire consequences. It is treated with anticoagulants for a period of time long enough for the obstructive lung vessel to recanalize. The underlying problem causing the pulmonary embolism is also treated. Lung cancer, one of the best known and most devastating of the respiratory system diseases, is characterized by abnormally growing lung tissue, which slowly but incessantly invades normal lung tissue and eventually results in tissue death. The major cause of lung cancer in the world is cigarette smoking, with recent laws enacted to outlaw smoking in most public areas that are inclusive, and with the active government campaigns to make the public aware of the relationship between cigarette smoking and lung cancer. The death rate from lung cancer, which has the highest death rate of all malignant tumors, has leveled slightly. Although treatment regimens are improving, the clinical outcomes associated with this disease are poor. Hopefully, current trends in the decrease in cigarette smoke will continue. Signs and symptoms: breathing problems. In case of respiratory illnesses, you are likely to suffer from shortness of breath or wheezing problems, especially after engaging in a strenuous activity or even mild exercises such as walking or climbing the stairs. The wheezing sound is a sign that the airways have become narrower. Coughing: you may notice an intermittent or continuous coughing, usually accompanied by mucus. A sputum-producing cough is present in almost all cases of respiratory diseases and is in fact one of the first signs of trouble. Uneasiness: one of the common symptoms of any respiratory disease is a feeling of uneasiness and tightness in the chest area. In case you experience persistent sensations of tightness in the chest, you may want to check for the presence of an ailment in the respiratory tract. Chest pain, which usually triggers off panic and alarm in most people, is not necessarily indicative of cardiac trouble but could also be an indication of more severe respiratory disease. Swelling, this is one of the more uncommon symptoms and can affect your fingers and toes. Therefore, in case you notice swelling in your finger or toes accompanied by a cough, it may be best to check for a problem that is related to the respiratory system. Blood, some of the respiratory illnesses of greater severity may cause you to cough up some amount of blood along with sputum. This is one of the most severe symptoms of respiratory diseases, and therefore it should never be ignored or taken lightly. Throat ache, due to excessive coughing, it is quite possible for you to suffer from pain and soreness in the throat. As a consequence of the soreness or inflammation, you may also affect your voice, may also change a bit. Your voice may also change a bit or may become a bit hoarse. You may need to clear your throat repetitively in order to get some relief from this problem. Diet, chicken soup can elevate many health conditions and can also help overcome respiratory problems. This is the actual, this has